So I decided to do my presentation on pinworms, otherwise known as Enterobiasis vermicularis. It's a scientific name for it, also known as the human pinworm. I chose this topic because I've always just been interested in pinworms and how humans actually contract the disease, what the worms do to your body, and how to get rid of it. How do humans get pinworms in the first place? So, simply by swallowing or breathing in the microscopic eggs that the adults will lay in various areas. This can occur by eating contaminated food or drinks, or coming in contact with eggs and touching your mouth or any other part of your face and then it getting in your mouth and into your system. So, the main transmission for it is usually children, because children touch everything and don't wash their hands or anything like that, and that is one of the major reasons it gets spread, because it gets under their fingernails and they touch their mouths and they touch you and everything else like that. It's very easily spread. Yeah. So the causative agent is a hylymph. It's a worm, a parasitic worm in terms. It's known as a pinworm. There's lots of types of parasitic worm infections, but this one's called the pinworm. They can live up to 13 weeks, and that's from the egg to the adult, so anywhere from that. The way we see them is with microscopes when they're eggs, but when they're adults, they're kind of like the size of like a quarter or less. And as you can see, here is a picture of the actual worm. And then here would be what the doctors will be looking at to see if you have the worms by the tape test that I'm going to be discussing later. So, characteristics of this disease, the infection begins after ingestion of microscopic eggs. The eggs stay in the intestines until they hatch and mature. So once they mature, the female will travel outside of the anus and lay her eggs around the outside in the skin folds of the anus. So all around there, she'll lay her eggs, and then when you go to sleep, she'll travel back in there and go back in your colon. So basically, they just start out as eggs. You breathe them in, and they go down to your intestines. And then once they mature, they move to your colon, because they're worms now. They can move. And then once you go to sleep, it's when they're most active, and they travel to the outside of your anus and lay eggs. And then this is how the process goes. You itch your anus, you spread them. So some signs and symptoms are very minimal. The only really thing that we see is itching around the anus area from the eggs, and that is from the female traveling outside of your anus and laying the eggs while you're sleeping, and the eggs stay on through the day, and you just itch and itch. Also, stomach aches and nausea are also common, but not as prevalent to this disease. So how we diagnose this is with a tape test, and basically all the tape test is a very sticky piece of tape that the doctor will give you, and usually you take it home. And what you do is first thing in the morning when you wake up is when most eggs are going to be on your anus and present at that time, because through the day they fall off. You take showers, there's not going to be as many. So you take the tape and you stick it on the outside of your anus, just in all areas. And then the doctors usually recommend to do this for a consecutive 3 days, so you can make sure you're getting eggs on the tape at each time. So if one of the pieces of tape doesn't have the eggs, maybe the other two will. And the way that the doctors will confirm that you have it is by putting the tape under a microscope and looking for eggs. If you have the eggs, you have the infection. So treatment of pinworms consists of anti-parasitic medications, and these are in pill form usually. Anti-itch creams can also be used to alleviate the itching and the discomfort around your anus, because it is very uncomfortable. There's eggs there, the worms crawl around, so if that's also what you want to do for that, that is fine. The medications are called Vermox, Albenza, and Reese's pinworm medication. Since pinworms are so easily transmitted, all members of your household will need to be treated because of just how easily this is to be spread. So make sure everybody's being treated for the pinworms if someone in your household comes down with the infection. It is treated with an initial dose and then a second dose 2 to 3 weeks later. So just to make sure that that infection is completely gone is why we have the 2-dose system. So some complications of pinworms. This infection, they say, is usually not that serious, but it can be if you're a female, because if you're heavily infected, those worms and the eggs can travel to your other female genitalia and lay eggs in those areas and can become very infected, the female genitalia. Other complications, though not as common, are urinary tract infections, weight loss, and infection of the peritoneal cavity. So that's like your abdomen and areas like that, like because the worms are in your intestines, they're in the colon, they're all in there. So that's some complications for the disease. So who is at risk for pinworms? Like who has the most chance of contracting this infection? And that is children. Children in daycare settings, caregivers and family members of the infected person, because everything that the infected person touches has a chance of having the eggs on them. People who live in crowded institutions, like group homes, nursing homes, just people living in a tight space and using all the same objects on a daily basis. Everyone's sharing things, stuff like that. But your children are going to be the main points because children don't wash their hands as much as adults do, hopefully. And they'll scratch the area, they'll touch you, they'll touch everything. So that's usually how they get spread. So prevention of pinworms is simply washing your hands is one of the main points that I can stress to you. And all of these references for prevention are from the Mayo Clinic website. My reference is at the end of this PowerPoint, and I'll show you that after a bit. Changing your underwear and bedding daily. This will be getting rid of those worms the eggs that are already present on your underwear and your bedding. So making sure that we're just cleaning those out and not just keep going on top of each other, you know what I mean? So, and if we're going to be changing our underwear and bedding, make sure we launder them in hot water. So you don't want to wash your clothes in cold water. The hot water is going to get rid of those eggs and just make everything clean. Do not scratch your anus and trim your fingernails. Make sure your children's fingernails are always trimmed to a good length because children are, like I said, the main transmitters. They'll scratch their anus and then touch everything else and get it all over the place. So make sure their fingernails are trimmed. And make sure you're not scratching. I know that's going to be hard when you have a worm living down there, but you don't want to scratch because that's how it's transmitted, and that's how it's just, the cycle will just keep going on and on if you don't follow these preventive measures, even if you do have the pinworms. This is for if you do or don't have the pinworms. Keep that in mind. And always wash your hands. Can't stress that enough. You need to wash your hands all the time if you do or if you don't have pinworms, because I'm serious, they're really contagious. If somebody has them, you're probably going to get them if you come in contact with them. And especially wash your hands before eating or drinking or doing anything that your hands have touched that you're going to consume, because that's how the eggs get in there in the first place. So everyone's always scared about getting their dogs worms, like a lot of dogs, cats, stuff like that, come down with worms or eating like dead animals and stuff like that. And these worms have overcome the carcass and stuff, and they're eating them, and you notice they have worms. Can I get the worms? No. Humans are the only host to these pinworms. You cannot give them to your pets. Your pets cannot give them to you because humans are the only host for these pinworms. If someone in your household is infected with the worms, you do not need to treat your pets. Your pets will be fine. You just need to treat every human living in your household. So, like I said, my references are the Mayo Clinic and CDC. I got most of my information from the Mayo Clinic, but the CDC has a lot of factual evidence that I picked up, and that's all. Thank you.